do the myofascial stretching exercise, you want to get into a half kneeling position. So like you're in the bottom of a lunge. Whatever knee is on the floor, that's going to be the psoas major you're going to be stretching. From here, you want to move your foot over to the side and then translate your hips over to the side. Then with the back leg, you want to go into medial rotation by pushing the ankle. Hey everyone, Steven here from Team Euphoric, and this week's YouTube shorts are all going to be dedicated to the psoas major. The reason I'm going to be picking the psoas major is because in my practice, a lot of patients come to me presenting with low back pain, and oftentimes when someone comes presenting with low back pain, it's going to be due to some type of dysfunction in the lumbopelvifemoral complex. And the psoas major is the one muscle that is involved in all three of those areas because it attaches to the lumbar spine, it crosses the pelvis, and it attaches to the actual femur. So if you have issues with regard to low back pain, hip pain, or knee pain, a lot of times the psoas major is going to be the culprit. So I'm going to be going over this week the anatomy and different exercises you could do for it. The most important structures that we want to note are going to be the lumbar spine, the pelvis, and the femur. The reason being those are where exactly it attaches and those are the areas that it crosses. With regard to the lumbar spine, these right over here are known as the vertebrae. And the vertebrae, this big part right over here is the actual vertebral body. Out to the side, you have the transverse process. And then in between the vertebrae, you have these little discs that are referred to as the intervertebral discs that provide a little bit of cushion for the spine. Then we have the pelvis. We have the ilium right over here, and then the femur. With regard to the femur, one thing worth noting is the lesser trochanter. That is going to be a very important thing when discussing the psoas major, but that is pretty much the skeletal anatomy for the psoas major. The psoas major attaches anterolaterally on the vertebral bodies of T12 all the way down to L5, and also the intervertebral disc in between them. And then it also attaches anteriorly on the transverse processes of L1, 2, 3, 4, and 5. And then from there, it attaches into the lesser trochanter of the hip. So because it crosses anteriorly on the lumbar spine, pelvis, and the femur, it's going to have actions on all three of those areas. At the lumbar spine, when they contract bilaterally, it's going to be responsible for flexion. When they contract unilaterally, it's going to be responsible for ipsilateral flexion and contralateral rotation. At the pelvis, when they contract bilaterally, it's going to be responsible for anteversion or anteriorly tilting the pelvis. When it contracts unilaterally, it's going to be responsible for contralateral rotation of the pelvis. And at the femur, it is going to be responsible for flexion of the hip, adduction of the hip, and then lastly, it's going to be responsible for lateral rotation of the femur. But those are the actions of the psoas major muscle. The psoas major is innervated by the lumbar plexus, which is these yellow little things sticking out from the vertebrae, and specifically it's going to be the L1, L2, and L3 nerve roots. So the reason this is going to be very important is because on Sunday when we do the ELDOA exercises, we're going to want to do the ELDOA exercises that are around the L1, L2, and 3. So we're going to take you through the L1, L2 ELDOA and the L2, L3 ELDOA. Today I'm going to be demonstrating some strengthening exercises for the psoas major muscle, and specifically we're going to be doing 3 different exercises. They're all going to be for the anteromedial portion of the psoas major. And for the first one, you want to be in a neutral position. Your arms are going to be at the level of the glenohumeral angle. If you don't know where that is, it's a little bit different based off of everybody's morphology, but anywhere from 90 to 135 degrees. For the average person, when your arms are fully extended and your palms are roughly up the level of your forehead or slightly higher, that is going to be your glenohumeral angle. But for this one, arms at the glenohumeral angle, arms in maximum external rotation. And then what you want to do, if we want to just do the general strengthening exercise, we're going to go into hip flexion, and that is just a neutral position to work on the anteromedial fibers of the psoas major. Then, if we want to target the medial portion, we're going to do a combination of flexion of the hip with medial rotation of the hip. So we're flexing and going into medial rotation. And then if we want to target the lateral portion, we are going to go into flexion and lateral rotation. And those are the 3 strengthening exercises for the anteromedial portion of the psoas major. To do the myofascial stretching exercise, you want to get into a half kneeling position. So like you're in the bottom of a lunge. Whatever knee is on the floor, that's going to be the psoas major you're going to be stretching. From here, you want to move your foot over to the side and then translate your hips over to the side. Then with the back leg, you want to go into medial rotation by pushing the ankle outside away from the knee. And then you want to push the ankle away from the knee. Then you want to go into retroversion of the pelvis, and you want to go into extension of the hip by driving your hips forward. From here, maximum extension of elbow and wrist, maximum external rotation. At the lumbar spine, we want to do a contralateral side bend and ipsilateral rotation, and then we want to keep the chin tucked in, crown of the head up, eyes looking down at the floor to put the dura mater under tension. With the palms, we're pressing away with the palms and holding this for 30 seconds. You want to do 3 sets of 30 seconds, and that is the myofascial stretching exercise for the psoas major muscle. The first is going to be the L2, L3 ELDOA. For this one, you're in a seated position. You want to abduct your thighs to 45 degrees. You want maximum extension of the knees, pseudo-inversion by going into dorsiflexion and inversion of the ankles, then maximum medial rotation of the femurs. You want to maintain retroversion of the pelvis, flat lumbar spine, flat thoracic, chin tucked in, crown of the head up, eyes looking down at the floor to put the dura mater under tension. With the arms, maximum extension of elbow and wrist, maximum external rotation. You want to flex the arms to the level of the coronal plane, so biceps in line with the ear, and you're pressing up with the palms and up with the crown of the head. And that is the L2, L3, LDOA. Then for the L1, L2, very similar. We're only going into 20 degrees of abduction though. Maximum extension of knees, dorsiflexion of ankles, inversion of ankles, maximum medial rotation of femurs, retroversion of pelvis, flat lumbar spine, flat thoracic, chin tucked in, crown of the head up, eyes looking down into the floor to put the dura mater in retention with the arms, maximum extension of elbow and wrist, maximum external rotation, then flex the arms to the level of the coronal plane and bring the arms to the level of the glenohumeral angle and then press away with the palms. And that is the L1, L2, LDOA.